Good afternoon. First, I want to take a moment and acknowledge that today is Juneteenth. Today marks 155 years since that fateful day in 1865, when black slaves in Texas learned that they had been granted their freedom 2 years earlier in 1863 at the signing of the Emancipation Proclamation by President Lincoln. The word is a combination of June and 19th, because on that day in 1865, Major General Gordon Granger of the Union Army launched in Galveston, Texas, and informed the slaves that the Civil War had ended and slavery has been abolished. And the roughly 250,000 slaves living in Texas at the time were shocked to hear that their freedom was old news to everyone but them. So Juneteenth is the day when we as black people celebrate all of our people finally getting their freedom in this country. Because like the great civil rights leader Francis Lou Hamer said, nobody's free until everybody is free. So let me be the first to say Happy Juneteenth, Baltimore. June is LGBTQ Pride Month, and today begins Pride Week in Baltimore. This year's theme is Say It Loud, Baltimore Virtual Pride 2020. This year, my office has planned a Virtual Pride Week, which will be centered and celebrated Black LGBTQ experiences, legacies, and dreams. Through continuing education, art and culture, unity and togetherness, and community organizing. This month and every month, we stand strongly with all of the lesbian, gay, bisexual, transgender, and queer people of Baltimore. On behalf of the City of Baltimore, I'd like to wish all residents a very happy and transformational Pride. Since Friday, June the 12th, we have seen a 7% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 6,938 reported cases, 204 people hospitalized with COVID-19, and 310 deaths. I'm up here every week to ensure our residents have the most up-to-date and accurate information so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in the City of Baltimore. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. I also want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. I'm happy to announce Baltimore City will move to phase 2 of our reopening strategy. I've been carefully weighing a combination of factors, including our health-related data, the economic impacts of continued closures, and I have made the decision to expand reopenings effective at 5 p.m. today. This means that businesses like restaurants, bars, gyms, and cultural institutions can reopen at 50% capacity. I want to be crystal clear. Loosening restriction does not mean that the threat of infection is gone or that these activities are risk-free. We will strongly recommend social distancing and hand washing with warm water and soap for at least 20 seconds. Residents are required to wear a cloth face covering when in public and to stay home if ill. Baltimore City's Phase 2 reopening includes the following: religious facilities which may reopen for indoor service, total number of people not to exceed 50% maximum occupancy. Retail establishments in malls, shopping centers with one or more enclosed pedestrian concourse may open to the general public at 50% max capacity. Additionally, all staff are required to wear face coverings while in areas open to the general public and areas in which interaction with other staff is likely, and continue promotion of social distancing. Personal services, beauty salons, barber shops, tattoo parlors, tanning saloons, massage parlors, and establishments that provide aesthetic services or provide nail technician services may open at 50% max capacity by appointment only. Additionally, all staff are required to wear face covering while in the areas open to the general public and areas in which interaction with other staff is likely. And after providing service to each customer, clean and disinfect the areas in which services were performed in accordance with applicable guidelines from CDC and MDH. Recreational establishment, bowling alleys, bingo halls, pool halls, roller skating rinks, social and fraternal clubs may open to the public at 50% max occupancy. Food service establishments, restaurant, bars, clubs, social clubs, and dining facilities may open to the public with indoor seating at 50% maximum capacity. Additionally, all staff must wear a cloth face covering, no serving of food in a buffet, no service of customers who aren't seated, continue promotion of social distancing, and clean and disinfect each table between seatings in accordance with CDC and MDH guidelines. Fitness centers may open to the public at 50% max capacity. Additionally, all staff must wear cloth face covering, and facilities may provide sufficient cleaning materials for patrons to wipe down machines between each use. Childcare facilities are now allowed 15 individuals per classroom, up from 10. Youth camp programs, no groups of campers and staff to exceed 15 at any given time, and this is both indoor and outdoor camps, and again, up to 10. Libraries may open to the public at 50% maximum occupancy. The Baltimore Zoo may open to the public at 50% max occupancy. Aquariums and museums may open to the public at 50% max occupancy. Non-essential office may open to the public at 50% max occupancy. Telework is still strongly recommended. Pools, indoor and outdoor pools and aquatic centers may open to the public at 50% max occupancy. Additionally, they must abide by all guidelines set forth by MDH. Sports gathering, indoor and outdoor, may resume sporting activities at 50% indoor capacity, outdoor at 100%, but no general public or spectators allowed. Additional indoor social distancing must be maintained, and for all, and to the extent possible, face covering should be worn. Casinos may open at 50% maximum occupancy. Additional patrons will be required to wear face covering and continue promotion of social distancing. Additional recommendations, safeguards are cleaning of frequent touch point areas, door handles, and restrooms in between patrons. Performance of temperature checks for every employee and implementation of policy around returning home if ill. Temperature checks are also advised for all patrons entering the premises. Again, I want to remind residents that all of these things are low risk, but not without risk. And the threat of COVID-19 is still present in Baltimore City. I want to thank our residents and business community for their patience and their commitment to the public health of our city. And again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidelines. We will continue to monitor the data daily, and if things take a turn for the worse, I will not hesitate to reinstate restrictions. Now I will ask Baltimore City Health Commissioner Letitia DeRosa to update you on our COVID-19 response and how you can continue to protect yourself and your loved ones from COVID-19. She will discuss some harm reduction strategies for making these activities as safe as possible.
Thank you, Mayor Young. I also just want to take a minute and really commend Mayor Young for his leadership during such unprecedented times. None of us has lived through a pandemic, and we're all learning to navigate what the new normal is. We've all had to make tough decisions to protect our city residents. Throughout this pandemic, I've worked alongside Mayor Young, and he has always listened and respected my role as a health professionour. Making the decision to reopen was not a decision he made lightly. He examined local health and economic data, and he carefully weighed out the benefits and risks for our residents. So I thank you for that, Mayor Young. This decision to reopen more activities comes during a time where the world is still learning new information about COVID-19. While we knew that those with certain underlying health conditions were more at risk for developing serious illness, this week the CDC published data that the most commonly reported underlying conditions were cardiovascular disease or heart disease, diabetes, and chronic lung disease. We also now know that among groups with these specific underlying health conditions, hospitalizations are 6 times higher and deaths are 12 times higher compared with those cases of people who don't have any underlying conditions. So I want to be clear. The decision to reopen does not mean that we are back to normal or that we have defeated the disease and the coronavirus has somehow disappeared. 6 states, Arizona, Florida, Oklahoma, Oregon, Texas, and Nevada have all reported record numbers of increases in new cases after opening this week. Every day in Baltimore City, we're still seeing new cases of COVID-19. And every day, Baltimore City residents are succumbing to this disease. Our daily average number of new COVID-19 cases is between 85 to 90 people per day, while we continue to see 2 to 3 deaths per day as a result of COVID-19. So again, this virus is still very much present and affecting the health and the lives of those in our community. As businesses plan to reopen their doors, I urge owners and managers to remain vigilant and put appropriate safeguards and cleaning measures in place to protect both patrons and staff. There still remains a risk in going out. There are still likely very many individuals who aren't showing symptoms yet of COVID-19, but will later become positive. And those individuals are throughout our community. They're capable of spreading disease, even if they're not showing symptoms. So if you're opening up your business during this pandemic, you have a responsibility to reduce the chances of disease transmission within your establishment. I want to thank all of those businesses who created plans around how to reduce the chances of disease transmission in their facility. But I also want to be very clear that in going out, there still remains a risk of disease exposure. This increased risk requires all of us to be more responsible. If you're a resident planning to go to a retail store or a restaurant this weekend, understand that you are choosing to go out during an active and dangerous pandemic. We're now advising residents to keep a physical or digital note of the places that they visit and the instances and times in which they were in close contact with others for a prolonged period of time. This means places where you've been closer than 6 feet to others for more than 15 minutes, such as a restaurant, a retail establishment, or visiting a friend. This information will be vital to our contact tracers if you become positive or if a disease outbreak is identified. There are things that every single resident can do to reduce the risk of spreading disease. If you're not feeling well, do not go out. Again, if you don't feel well, please stay home. If you are going out, call ahead to the restaurant or retail business and ask what steps they're taking to keep patrons safe. Continue to wear your cloth face covering whenever you're in public, especially if you will be indoors with other people. Continue to wash your hands frequently or use hand sanitizer. And overall, ask yourself, what can I do to reduce contact that I'm having with other people? Digital contact is better than physical contact. Being at home is best, but being with others outdoors is safer than being with others indoors. Interacting with more people raises your risk. Being in groups with people who aren't socially distancing or wearing cloth face coverings also increases your risk. Again, I want to thank all of our residents and businesses who are abiding by the guidance that's been set forth. In doing so, you might just be saving a life. Thank you.
Thank you. We'll take a few questions. Just a few.
Mayor, I have a question, if you don't mind.
What was that?
Hi, Mayor.
Oh,
Originally, your phase two, looking back a couple of weeks ago, talked more in terms of a restaurant in phase two being 25% capacity. Now we're looking at 50, and then the religious gatherings that had 50 people, now we're looking at 50% capacity. I'm wondering, was there data or health information that changed sort of the landscape to change what phase two represents for the city?
Yeah, so we actually received a lot of questions because we recognized that our phase two was slightly different than the states. So for ease of compliance and just for general alignment, it made more sense to change our metrics to align with those of the state.
I understand. Thank you.
On the question of facial covering, you use the word required. This is obviously a big debate around the country. And just to be clear, so that in the city of Baltimore, facial covering in public is required. Am I correct?
yes. Even though it's being challenged. I've seen something on the news where a gentleman was escorted off of the plane because he refused to wear face covering. But if people want to protect themselves, because COVID-19 hasn't gone anywhere, it's still here, they would want to be required to wear a mask.
What is there a benchmark? We've seen there are 23 states where cases are now rising since reopening. Is there a benchmark you're looking at that would be like a trigger point for saying we need to pull back?
I'll let the health commissioner answer that, but if I see any increases, I want to protect the public.
So on our website, where the reopening indicators and phases are, we've listed the three things, and so it's related to number of cases, if we see an increase over a period of time, as well as number of deaths if we see an increase over a period of time. But that is up to date, as are these new phases on our website.
Should the public kind of get used to the idea of just having this kind of, caseload every day? There are going to be some new cases for some time to come?
I think as of right now, I mean, we're still rapidly expanding testing capacity. So, I mean, I think a few things. One, we're going to continue to see cases go up as we open more things. But as we start to test more, we could certainly also see additional rises in cases, especially as we get to communities that we know are harder hit, but maybe haven't typically had access to testing.
I have an unrelated question to coronavirus. Well, it is kind of related. It has to do with trash pickup.
Where's Chalmers? As you know, we had COVID-19 infection at our Bowley's Lane yard, and we had to shut that down. So we are still behind in picking up trash because, we're trying to get people back to work. And some people are refusing to come back to work. But I'll let Chalmers speak to that because I don't know whether they're coming back at a greater rate now because it's a part of their job, essential service.
Good morning. So as it relates to the Eastern District's trash collection, employees have reported back to work. We're slowly getting through this. You need to keep in mind that we're faced with a situation that we just, was unexpected. And we had 50% of the curbside collection go down. At the beginning of the pandemic, part of our strategy was to put people out on permission leave just in case we had an issue where we had to keep core services moving forward. That was the buffer, bringing those people back to work to keep services moving forward. So as of today, we are covering the routes. We are struggling to get through these routes. Since the shelter in place, there's been about a 22% increase in curbside trash collection. And on top of that, the fact that we've canceled citywide recycling, there's additional tonnage curbside. So as we work through this, providing PPE, crews are practicing social distancing, decontaminating their vehicles in the morning. It's going to be slower than usual to get through this. But I'm very optimistic that come next week when we start to bring back on the folks that were out on permission leave and quarantine, that we'll see services start to slowly improve.
Has there been any consideration of contracting with private haulers?
From the very beginning, we've looked at several contractors. We have 2 contractors that we're in conversation with. They can manage 2 routes, 2 of the northern routes. One of the biggest issues here in the city, in the inner city, we have the small 10-foot alleys. And most of the contractors use 25 cubic yarders and bigger trucks, and they can't get down those alleys. So that's one of the challenges we're faced.